Welcome to today's presentation. Let's take a moment to define each plane, as understanding these is fundamental to grasping the overall structure we're discussing. When we talk about planes, we're referring to different perspectives or dimensions within a system. Each plane offers a unique view that helps us analyze and interpret the components more effectively. By clearly defining these planes, we lay the groundwork for a more comprehensive understanding of how they interact and contribute to the bigger picture. Remember, these definitions are essential as we move forward, connecting each point to the overall theme of the presentation. Let's take a moment to look at the different bones that make up our skeletal system. As you can see on this slide, we're focusing on the names of these bones. Understanding the specific bones is fundamental because they each have unique roles and structures. For example, we have bones like the femur, which is the thigh bone and the strongest in our body, and the humerus in the upper arm. Then there are smaller but equally important bones like the carpals in the wrist and the tarsals in the ankles. Recognizing these bones by name helps us better understand how our body moves and supports itself. Remember, knowing the names is the first step toward understanding their functions and how they work together as a system. This knowledge is key as we explore how the skeletal system supports our overall health and mobility. Let's take a closer look at some of the key bones in the shoulder region. First, we have the scapula, which is often called the shoulder blade. It plays a crucial role in shoulder movement and stability. Next is the clavicle or collarbone, which connects the arm to the trunk and helps support the shoulder. Then there's the humerus, the long bone of the upper arm that extends from the shoulder to the elbow. These bones are fundamental to understanding shoulder anatomy and function. Recognizing their names and how they work together helps us appreciate the complexity and strength of the shoulder girdle. This connection between bones is what allows us to have such a wide range of motion and dexterity in our arms. Let's take a closer look at the clavicle, which is also known as the collarbone. This bone plays a crucial role in connecting the arm to the rest of the body, specifically to the sternum or breastbone. On this slide, we're focusing on the important features at the ends of the clavicle, because these are key to understanding how it articulates with other bones. First, you'll notice that the clavicle has two main ends. The sternal end, which is broader and connects to the sternum, and the acromial end, which is flatter and connects to the scapula or shoulder blade. Now, when we talk about the name of bone's ends, we're emphasizing how each end of the clavicle has a specific name and function. The sternal end is sometimes called the medial end because it's closer to the center of the body, while the acromial end is lateral, meaning it's positioned on the outer side of the body. Understanding these ends is essential because they help us see how the clavicle forms joints, the sternoclavicular joint with the sternum, and the acromioclavicular joint with the scapula. These joints are vital for shoulder mobility and stability. So, grasping the names and functions of these ends gives us a foundation for exploring how the clavicle contributes to shoulder movement and overall upper limb function. This connects to our larger theme of understanding the skeletal system's role in facilitating movement and supporting the body. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a moment to look at the names of these areas. Here, we're identifying the specific regions we're focusing on. Knowing the names helps us better understand their unique characteristics and roles within the larger system. It's important because each area has its own impact and significance, which ties back to our overall theme of understanding how different parts contribute to the whole. As we go through this, keep in mind how these names represent real places and concepts that influence the bigger picture we're exploring. Let's take a closer look at some key features of the scapula, starting with the coracoid process. This is a small, hook-like structure that projects anteriorly and serves as an important attachment point for muscles and ligaments. Moving on, we have the acromion process, which extends laterally from the spine of the scapula and forms the highest point of the shoulder. It plays a crucial role in shoulder movement and stability. Speaking of the spine of the scapula is a prominent ridge that runs across the posterior surface, dividing it into the supraspinatus and infraspinatus fossae. These fossae are shallow depressions that accommodate muscles involved in shoulder movements. The supraspinatus fossa is located above the spine, and the infraspinatus fossa is below it. Understanding these areas helps us appreciate how the scapula functions as a vital component of shoulder mobility and strength. Each of these regions not only supports muscles, but also contributes to the overall mechanics of the shoulder joint. Let's take a closer look at the names of these areas and how they articulate. Here, we're focusing on identifying the specific regions we're discussing and understanding how they connect and interact with each other. Recognizing these areas by their names helps us map out the overall structure and function. Articulation, in this context, refers to how these regions communicate, whether through neural pathways, muscular movements, or functional interactions. This understanding is crucial because it allows us to see the bigger picture of how different parts work together seamlessly. By pinpointing the names of these areas, we also set the foundation for discussing their roles in the broader system, which ties directly into the overall theme of integration and coordination within this complex network. So, paying attention to these details helps us appreciate both the anatomical and functional relationships at play. Now, let's take a closer look at the glenoid cavity. This is a shallow, pear-shaped socket that plays a crucial role in shoulder mobility. It articulates with the head of the humerus, forming what we call the shoulder joint, or more specifically, the glenohumeral joint. This joint is essential because it allows a wide range of motion for the arm. The key points here are the name of this area, the glenoid cavity, and its main function, which is to articulate with the humeral head to create a flexible yet stable shoulder joint. Understanding this connection is fundamental, as it highlights how the shoulder's anatomy enables us to perform so many complex movements while maintaining stability. Let's take a moment to look at the names of these areas. As you can see, each one has a specific role and significance within the overall framework we're discussing. It's important to recognize how these different zones interact and contribute to the larger system. By understanding the distinct purposes of each area, we can better appreciate how they work together to achieve our goals. This section helps us visualize the structure and flow, making it easier to grasp the bigger picture we've been building throughout this presentation. Let's take a closer look at some key anatomical landmarks on the humerus. First, we have the radial fossa, which is a small depression on the anterior distal end of the humerus that accommodates the head of the radius during elbow flexion. Next, the lateral epicondyle is a bony prominence on the outer part of the distal humerus, serving as an attachment point for forearm muscles and ligaments. Moving upward, we see the capitulum, a rounded condyle on the lateral side that articulates with the head of the radius, playing a crucial role in elbow movement. Adjacent to it is the trochlea, a spool-shaped structure on the medial side that articulates with the ulna, enabling hinge-like motion. On the medial side, we find the medial epicondyle, which is larger than the lateral one and serves as the attachment site for muscles of the forearm. The coronoid fossa is another anterior depression that allows for the coronoid process of the ulna to move forward when the elbow is flexed. Now, shifting to the posterior aspect, the intertubercular sulcus, also called the bicipital groove, is a groove between the greater and lesser tubercles. It guides the tendon of the long head of the biceps brachii muscle. On the scapular side of the humerus, the coracoid process is a hook-like projection that serves as an attachment point for muscles and ligaments stabilizing the shoulder. The subscapular fossa is the broad anterior surface of the scapula that faces the rib cage, providing attachment for subscapularis muscle. Moving on, the lesser tubercle is a smaller bump on the anterior proximal humerus, also serving as a muscle attachment. Finally, the greater tubercle is a larger prominence on the lateral side of the humerus, which provides attachment for rotator cuff muscles. All these areas are critical for understanding how the humerus articulates and interacts with surrounding bones and muscles, forming the foundation for shoulder and elbow movements that are essential in many daily activities. Let's take a closer look at these areas. First, we have the name of these areas, which is crucial because it helps us identify and categorize different regions or zones within our overall framework. Understanding the specific names gives us clarity and allows us to communicate more effectively about each one. These names are not just labels. They often carry significance related to their functions or characteristics, which can influence how we approach them. Recognizing these key areas connects directly to our main theme of understanding the structure and organization within this system. It helps us see the bigger picture and how each part fits into the whole. So, by knowing the names of these areas, we're better equipped to analyze, compare, and make informed decisions moving forward. Let's take a closer look at the olecranon process and the olecranon fossa. The olecranon process is that prominent bony point at the back of the elbow. It's what you might feel as the point of your elbow. It's essential because it serves as an attachment point for muscles and ligaments that control elbow movement. Next, we have the olecranon fossa, which is a deep depression on the posterior side of the humerus, just above the condyles. This fossa accommodates the olecranon process when the elbow is fully extended, allowing smooth movement without interference. Now, these areas are named quite logically. Olecranon refers to the process at the elbow's back, and fossa indicates a hollow or depression. Recognizing these structures helps us understand the anatomy of the elbow joint and how it functions during movement and stability. Connecting this to the overall theme, understanding these bony landmarks is crucial because they play significant roles in joint mechanics and are often involved in injuries or clinical assessments. So, knowing their location and function helps us grasp how the elbow operates in both health and disease. Let's take a moment to look at the names of these areas. Here, we're identifying the specific regions we're focusing on. Understanding the names helps us to contextualize the different parts and their roles within the overall system. These labels are more than just labels. They help us connect the concepts we've discussed so far to real-world locations and functions. Recognizing these key areas is crucial because it allows us to better grasp how each part contributes to the bigger picture. As we move forward, keep these names in mind, as they will help anchor the information and make complex ideas easier to understand. This is all about creating a clear map of the territory we're exploring in this presentation. Now, let's take a closer look at some key bony landmarks in this region. First, we have the ulnar tuberosity, which is a prominent area on the proximal ulna where the biceps brachii muscle attaches, playing a vital role in forearm flexion. Moving on, the coronate process is a triangular projection that fits into the trochlear notch of the humerus, providing stability to the elbow joint during flexion. The interosseous membrane is a fibrous sheet connecting the radius and ulna along their shafts, serving as a crucial site for muscle attachment and force transmission between these bones. Next, the radial tuberosity is a roughened area on the radius where the biceps tendon attaches, contributing significantly to forearm movements. The head of the radius is a rounded structure that articulates with the capitulum of the humerus and the radial notch of the ulna, facilitating rotation of the forearm. Lastly, the trochlear notch is a C-shaped groove on the ulna that articulates with the trochlea of the humerus, enabling the hinge movement of the elbow. Understanding these landmarks helps us appreciate how the bones and muscles work together to produce smooth and efficient arm movements. Let's take a moment to look at the names of these areas. Here, we're identifying the specific zones that are relevant to our discussion. These names are more than just labels. They help us understand the unique characteristics and functions of each region. Recognizing these areas is crucial because it allows us to see how they contribute to the overall system or environment we're studying. As we go through this presentation, keep in mind how each area's name reflects its role and importance within the bigger picture. This understanding will help us appreciate the interconnectedness of these regions and their impact on the entire topic. Let's take a closer look at some key features of the ulna. First, we have the head of the ulna, which is the rounded top part that connects to the radius. Moving down, on the posterior side, you'll find the ulnar styloid process, a small pointed projection that provides attachment points for ligaments. On the lateral side, there's the radial styloid process, which is similarly important for ligament attachments and articulation with the radius. Between these bones, you'll notice the interosseous membrane, a fibrous sheet that connects the ulna and radius along their shafts, playing a crucial role in stability and movement. Recognizing and understanding these areas is essential as they form the foundation for the structure and function of the forearm and wrist. Let's take a closer look at the names of these joints. As we've discussed, joints are essential for movement and stability in our body. Here, we're focusing on identifying and understanding the different types of joints by their names. Recognizing these names helps us connect their structure to their function. For example, some joints are designed for a wide range of motion, while others prioritize stability. By knowing the names, we can better understand how each joint contributes to our overall mobility and how they work together to support our daily activities. This understanding is fundamental as we explore how joints function and how injuries or disorders can affect them. So, keep these names in mind, as they'll come up again when we delve into their specific characteristics and roles. Now, let's take a closer look at the names of these joints. As you can see, understanding the specific names is crucial because it helps us identify their location and function within the body. These joints are not just random connections. Each has a unique role in facilitating movement and stability. Recognizing their names allows us to better grasp how the musculoskeletal system works as a whole, which is essential for both understanding injuries and designing effective treatments. So, as we go through the different types, keep in mind how each one contributes to our overall mobility and strength. Now, let's take a closer look at these parts, or segments, and understand their significance. As we explore different segments, it's important to recognize how each one plays a vital role in the overall structure and function of the system. Identifying these parts helps us better grasp how everything fits together and interacts. By naming and understanding these segments, we can appreciate the complexity and the design behind it all. This knowledge also enables us to analyze, troubleshoot, and improve the system more effectively. So, paying attention to these parts is key to mastering the bigger picture of the project. Let's take a closer look at some of the key bones in the wrist. We have the triquetrum, which is one of the carpal bones, followed by the pisiform, another small carpal. Then there's the lunate, a central bone that plays a crucial role in wrist movement, and the scaphoid, which is important for stability and support. These bones are all parts of the carpal segment, which forms the wrist joint. Moving beyond the wrist, we have the phalanges, which are the finger bones. These are the bones that make up our fingers themselves. Then, we have the metacarpals, the bones that connect the wrist to the fingers, providing support and structure for the hand. Lastly, all of these bones together make up the carpals, metacarpals, and phalanges, the main segments of the hand. Understanding these parts is essential because they work together to give us the dexterity and range of motion we rely on daily. This overview highlights how interconnected and specialized each part is within the hand's anatomy, which ties back to the overall theme of hand functionality and biomechanics. Let's take a closer look at this slide, where we focus on the specific problem and the entrapment structures involved. The first point to understand is the importance of clearly naming the problem. Giving it a precise name helps us communicate more effectively and sets the stage for targeted solutions. Next, we need to identify the entrapment structures. These are the physical or systemic barriers that keep the problem in place. Recognizing these structures is crucial because they often reinforce the issue, making it harder to resolve without addressing them directly. By understanding both the problem's name and the entrapment structures, we gain a clearer picture of the root causes. This understanding aligns with the overall theme of our presentation, which is about uncovering hidden barriers and finding effective ways to overcome them. So, in essence, this slide emphasizes the significance of accurately defining problems and pinpointing the structures that sustain them as a foundation for developing meaningful solutions. Now, let's take a closer look at the name of this problem and the concept of entrapped structures. This slide highlights the importance of identifying the specific issues we face, which are often encapsulated in the problem's name itself. Understanding the terminology helps us grasp the core challenges more clearly. When we talk about entrapped structures, we're referring to those parts of a system or process that become locked or constrained in a way that prevents optimal function or progress. These structures can be physical, like a building's framework, or more abstract, like organizational hierarchies or communication pathways. Recognizing these entrapped elements is crucial because they often serve as the root causes of inefficiency or failure. By pinpointing these structures, we can develop targeted strategies to unlock or restructure them, ultimately improving overall performance. This concept ties directly into our broader theme of systemic analysis and problem solving. To effectively address complex issues, we need to understand not just the symptoms, but the underlying structures that sustain them. So, identifying the problem's name and the entrapped structures gives us a foundational step towards meaningful intervention and sustainable solutions. Let's take a closer look at the different types of joints. Joints are essential because they connect bones and allow for movement and stability in our bodies. The first key point is that joints can be classified based on their structure and function. Structurally, we have fibrous, cartilaginous, and synovial joints. Functionally, they are categorized as immovable, slightly movable, or freely movable. Understanding these differences helps us see how the body balances flexibility and support. For example, fibrous joints, like those in the skull, are mostly immovable, providing protection. Cartilaginous joints, like those between the vertebrae, allow slight movement, offering both stability and flexibility. The most common and versatile are the synovial joints, such as the knee or elbow, which enable a wide range of motion. Connecting this to the overall theme, recognizing the types of joints helps us appreciate how our skeletal system functions efficiently, supporting our daily activities and movement patterns. It's fascinating to see how each joint type plays a specific role in maintaining body mechanics and health. Now, let's take a closer look at the different types of joints. Joints are essentially the connections between bones, and they play a crucial role in allowing us to move and stay stable. There are several types, each with unique characteristics. The main categories are fibrous, cartilaginous, and synovial joints. Fibrous joints are held together by dense connective tissue and are mostly immovable, like the sutures in our skull. Cartilaginous joints, on the other hand, have cartilage between bones and allow for limited movement, like the joints between the vertebrae. Then we have synovial joints, which are the most common and highly movable type. These joints feature a synovial cavity filled with fluid, and they are surrounded by a capsule. Think of your knee or elbow. These are classic examples of synovial joints, providing a wide range of motion. Understanding these different types helps us appreciate how our skeletal system balances stability and flexibility, which is essential for everyday movement and overall function. Let's take a closer look at the different types of joints and the specific areas they involve. As we go through this, keep in mind how these joints contribute to the overall mobility and stability of the body. First, we have the fibrous joints, which are connected by dense connective tissue and are mostly immovable. An example of this would be the sutures in our skull. Next, there are cartilaginous joints, where bones are linked by cartilage, providing a bit more flexibility, like the joints between the vertebrae in our spine. Finally, we have synovial joints, which are the most movable type of joints. These include the knees, hips, and shoulders, and they have a synovial cavity filled with fluid to facilitate smooth movement. Recognizing these areas and their differences helps us understand how our body balances stability with flexibility as we move through daily activities and athletic pursuits. Let's take a closer look at the different types of joints. Joints are essential because they connect bones and enable movement and stability in our bodies. There are several main types, each with unique structures and functions. The first type is fibrous joints, which are held together by dense connective tissue. These joints are mostly immovable, like the sutures in our skull. Next, we have cartilaginous joints, where bones are connected by cartilage. These allow for limited movement, such as in the spine or the pubic symphysis. Then, there are synovial joints, which are the most movable type. They feature a fluid-filled cavity that reduces friction, allowing for a wide range of movements. Think of your knees, elbows, and shoulders. Understanding these different joint types is crucial because they reflect how our skeleton is designed for both stability and flexibility, which ties into the overall theme of how our body functions efficiently for daily activities. Let's take a closer look at some of these movements and their corresponding areas or girdles. As you can see, each movement is associated with a specific part of the body, which helps us understand how the entire system functions together. For example, movements involving the shoulder girdle, like elevation or depression, play a crucial role in upper limb mobility. Similarly, movements of the pelvic girdle, such as tilting or rotation, are essential for posture and locomotion. Recognizing these areas helps us appreciate how interconnected our body movements are and how each girdle contributes to our overall mobility and stability. This understanding is fundamental as we explore the complex coordination required for even simple actions. Now, let's take a closer look at a specific muscle by examining its name, origin, insertion, and action. Understanding these key points helps us grasp how each muscle functions within the musculoskeletal system. When we talk about the name, it often gives us clues about the muscle's location or role. The origin refers to the fixed point where the muscle begins, usually on a bone or cartilage, while the insertion is where the muscle attaches to movable bones. The action describes what the muscle does when it contracts, such as flexion, extension, or rotation. Connecting these details to the bigger picture, recognizing these features allows us to understand how muscles work together to produce coordinated movements essential for daily activities and athletic performance. Let's take a closer look at the pectoralis minor muscle. It originates from the ribs, specifically the 3rd to 5th ribs. From there, it inserts onto the coracoid process of the scapula. The primary actions of this muscle are scapular protraction, which helps move the shoulder blade forward, and downward rotation of the scapula. These movements are important for shoulder stability and proper arm functioning. Understanding how this small but significant muscle works connects to our overall theme of how shoulder and scapular muscles coordinate to support upper limb movement and stability. Let's take a closer look at some key muscles, starting with their names, origins, insertions, and actions. Understanding these points is essential because it helps us grasp how each muscle contributes to movement. For example, when we talk about a muscle's origin, we're referring to the point where it begins, usually on a fixed bone. The insertion, on the other hand, is where the muscle attaches to the movable bone. The action describes what the muscle does when it contracts, whether it flexes a joint, extends it, or performs some other movement. By connecting these details, we get a comprehensive picture of how muscles work together to facilitate our movements and maintain stability. It's this foundational knowledge that underpins our understanding of the entire muscular system and how it supports our body's function. Let's take a closer look at the serratus anterior muscle. It originates from the first 9 ribs, which means it has a broad attachment along the upper ribs. From there, it inserts onto the medial border and the inferior angle of the scapula, anchoring it securely to the shoulder blade. This muscle plays a crucial role in scapular movements. Its main actions are scapular protraction, which is essential for reaching movements, and upward rotation, which helps lift the arm overhead. Understanding the serratus anterior's origin, insertion, and actions is key, because it highlights how this muscle contributes to shoulder stability and mobility. It's a perfect example of how the muscles we studied earlier work together to allow complex, functional movements. Let's take a closer look at this slide, which focuses on the name of a specific muscle, along with its origin, insertion, and action. Understanding these key points is crucial because they help us grasp how muscles function and work together to produce movement. When we talk about the origin, we're referring to the point where the muscle attaches to the stationary bone, which provides stability. The insertion, on the other hand, is where the muscle attaches to the moving bone, and this is where the action happens. The action describes what the muscle does when it contracts, such as flexion, extension, or rotation. By connecting these points, we get a comprehensive picture of how each muscle contributes to our overall movement and posture. This knowledge is essential as it ties into the bigger picture of muscle anatomy and biomechanics, helping us understand how our body moves and maintains function. Let's take a closer look at the trapezius muscle. Its origin points are the occipital bone at the back of the skull, as well as the spinous processes of the cervical and thoracic vertebrae. These serve as the attachment sites from which the muscle fibers extend. Moving to its insertion points, the trapezius attaches to the clavicle, specifically the lateral third, as well as the acromion process and the spine of the scapula. These are the key points where the muscle pulls on the skeleton to produce movement. Now, regarding its actions, the trapezius is quite versatile. The upper fibers are responsible for elevating the scapula, which is what happens when you shrug your shoulders, and they also help in upward rotation of the scapula. The middle fibers work to retract the scapula, pulling it toward the spine. Think of squeezing your shoulder blades together. The lower fibers depress the scapula and assist in upward rotation. Together, these fibers coordinate movements crucial for shoulder stability and mobility, connecting to the overall theme of how muscles work together to produce complex motions. Let's take a closer look at the muscles we're studying. On this slide, we'll focus on the name of the muscle, its origin, insertion, and its main action. Understanding these key points helps us grasp how each muscle functions within the body. The origin refers to where the muscle begins, typically on a stable bone or structure, while the insertion is where the muscle attaches to move the bone or part during contraction. The action describes what the muscle does when it contracts, such as flexion, extension, or rotation. Recognizing these aspects is essential because they connect the muscle's structure to its function, allowing us to see how muscles work together to produce movement. This knowledge forms the foundation for understanding overall musculoskeletal function and movement mechanics. Now let's take a closer look at some of the key muscles we've been discussing. For each muscle, we'll go over its name, where it originates, where it inserts, and what action it performs. This helps us understand how these muscles work together to enable movement. Remember, the origin is where the muscle starts, typically on a fixed bone, and the insertion is where it attaches to the moving bone. The action describes what the muscle does when it contracts. By connecting these points, we get a clearer picture of how muscles coordinate to produce specific movements, an essential part of understanding human anatomy and function. Now, let's take a closer look at the rhomboids, both minor and major. These muscles originate from the spinous processes of C7 to T1 for the minor and T2 to T5 for the major. They both insert on the medial border of the scapula. Their primary actions are scapular retraction, which means pulling the shoulder blades together, and downward rotation, which helps position the scapula properly during movements like lowering the arm. Understanding these muscles is crucial because they play a key role in shoulder stability and movement, tying into the overall theme of shoulder and back muscle function. Let's take a closer look at the muscles based on their actions. When we talk about protraction, we're referring to muscles that move the scapula forward, such as during pushing movements. For retraction, those muscles pull the scapula backward, like when you squeeze your shoulder blades together. Elevation involves muscles that lift the scapula, like when you shrug your shoulders. Depression is the action of lowering the scapula, such as when you relax your shoulders downward. Upward rotation occurs when the scapula rotates so the glenoid cavity moves upward, which is important during arm elevation. Conversely, downward rotation rotates the scapula back down, returning it to the resting position. Recognizing these muscle actions helps us understand how different movements are coordinated and which muscles to target during training or rehabilitation. This classification by action provides a clear framework for understanding shoulder and scapular mobility and stability. All right, let's take a closer look at the muscles involved in different shoulder actions. When the scapula protracts or moves forward around the rib cage, the key muscles are the pectoralis minor and the serratus anterior. These muscles work together to pull the scapula forward and around the thorax, which is important in reaching or pushing movements. For retraction, or pulling the scapula back towards the spine, the main players are the middle trapezius and the rhomboids, both major and minor. These muscles retract the scapula, bringing the shoulder blades closer together, which is crucial for posture and pulling motions. When it comes to elevation, lifting the scapula upwards, the upper trapezius and the levator scapula are primarily responsible. These muscles elevate the shoulder girdle, such as when shrugging your shoulders. Depression, which involves lowering the scapula, primarily engages the lower trapezius. This action depresses the shoulder, like when you push down on a weight or lower your shoulders after shrugging. Upward rotation, the movement that lifts the arm overhead, involves the upper and lower trapezius along with the serratus anterior. These muscles coordinate to rotate the scapula upward, enabling full arm elevation. Finally, for downward rotation, which brings the arm back down from an overhead position, the main muscles are the pectoralis minor, levator scapula, and the rhomboids. These work together to rotate the scapula downward, helping to control and stabilize shoulder movements. Understanding which muscles are responsible for each action helps us appreciate the complexity and coordination involved in shoulder movements and highlights the importance of these muscles in maintaining shoulder health and function. Now, let's take a closer look at the pectoralis major, one of the key muscles involved in shoulder movement. This muscle has its origin on the clavicle, the sternum, and the ribs from the second to the sixth. These points of origin provide a broad base, allowing the muscle to perform multiple functions. Its insertion is at the intertubercular sulcus of the humerus, which is essentially a groove on the upper arm bone. When the pectoralis major contracts, it primarily causes shoulder adduction, meaning bringing the arm toward the body's midline. It also facilitates horizontal adduction, which is moving the arm across the chest, and internal rotation, turning the arm inward. These actions are vital for many daily activities and athletic movements, especially those involving pushing or lifting. Understanding the origin, insertion, and actions of this muscle helps us grasp how the shoulder complex moves and stabilizes during various tasks. Let's take a closer look at this slide, which focuses on the name of the muscle along with its origin, insertion, and action. Understanding these key points is essential because they help us grasp how each muscle functions within the body. First, the name of the muscle often gives us clues about its location or function, which makes it easier to remember. For example, muscles with brachii are in the arms, while femoris refers to the thigh. Next, the origin is where the muscle starts, usually on a stationary bone or structure. It's the anchor point that doesn't move much during contraction. The insertion is where the muscle attaches on the bone that moves when the muscle contracts. This point is crucial because it determines the direction of movement and the muscle's leverage. Finally, the action describes what the muscle actually does, whether it flexes, extends, abducts, or performs some other movement. Recognizing these actions helps us understand how muscles contribute to our overall movement and stability. Remember, connecting the muscle's name, origin, insertion, and action allows us to see the bigger picture of how our muscular system works seamlessly to produce coordinated movement. This integrated understanding is fundamental as we explore more complex structures and functions in the body. Let's take a closer look at this slide, which focuses on the name of the muscle, along with its origin, insertion, and action. Understanding these key points is essential because it helps us see how each muscle contributes to movement. The origin is where the muscle begins, usually on a fixed bone, providing a stable starting point. The insertion is where the muscle attaches to the movable bone, and it's where the action takes place. The action describes what the muscle does when it contracts, whether it moves a limb, stabilizes a joint, or performs some other function. By knowing these details, we can better understand how muscles work together to produce coordinated movement. This knowledge is fundamental in both anatomy and clinical practice, as it helps us identify which muscles are involved in specific actions and how to target them in therapy or training. So, this slide ties into the overall theme of understanding muscle function and movement mechanics in the body. Now, let's take a closer look at the latissimus dorsi. This muscle originates from the spinous processes of the lower thoracic and lumbar vertebrae, as well as ribs 9 through 12. These points of origin give it a broad base on the back. The latissimus dorsi inserts into the intertubercular sulcus of the humerus, which is essentially a groove on the upper arm bone. This muscle plays a key role in shoulder movements. Specifically, it is responsible for shoulder extension, which means moving the arm backward. It also aids in adduction, pulling the arm toward the body's midline, and internal rotation, which is turning the arm inward. These actions are crucial for many activities like pulling, climbing, or even certain swimming strokes. Understanding the origin, insertion, and function of the latissimus dorsi helps us appreciate how it contributes to the overall movement and stability of the shoulder. This muscle is a vital part of the posterior chain, supporting both everyday movements and athletic performance. Now, let's take a closer look at some key muscles, starting with their names, origins, insertions, and actions. Understanding these fundamental details helps us grasp how each muscle contributes to movement. For example, knowing where a muscle originates and inserts allows us to see how it pulls on bones to generate motion. The action describes what the muscle does when it contracts, whether it's flexing, extending, rotating, or stabilizing a joint. This information is crucial because it connects the anatomy to the function, illustrating how our muscular system supports everyday activities and complex movements alike. As we go through each muscle, keep in mind how these details fit into the bigger picture of human movement and biomechanics. Let's take a closer look at the deltoid muscle. Its origin points are the clavicle, the acromion, and the spine of the scapula. These attachment sites make it quite versatile in shoulder movement. The deltoid inserts at the deltoid tuberosity of the humerus, which is essential for its leverage during arm movements. Innervation-wise, it's supplied by the axillary nerve, a key point to remember for nerve injuries affecting shoulder function. Now, regarding its actions, the deltoid is quite dynamic. The anterior fibers are responsible for shoulder flexion and internal rotation, meaning they help lift the arm forward and rotate it inward. The middle fibers are the primary abductors of the shoulder, lifting the arm away from the body. The posterior fibers extend the shoulder and assist in external rotation, moving the arm backward and rotating it outward. Understanding these different fiber actions helps us see how the deltoid contributes to a wide range of shoulder movements, which is central to our overall exploration of shoulder anatomy and function. Now, let's take a closer look at some specific muscles, starting with their names, origins, insertions, and actions. Understanding these key points helps us see how each muscle contributes to movement and stability. For example, when we talk about a particular muscle, I'll mention where it originates, which is usually on a fixed bone or structure, and where it inserts, meaning the point of attachment that moves when the muscle contracts. The action describes what the muscle does, whether it moves a limb, stabilizes a joint, or assists in other functions. Recognizing these details is essential because it ties into the overall theme of understanding muscle function and how our body performs complex movements seamlessly. Now, let's take a closer look at the coracobrachioles muscle. This muscle originates from the coracoid process of the scapula, which is that small hook-like structure on the front of the shoulder blade. From there, it extends downward to insert on the shaft of the humerus, specifically on the medial side. Its innervation comes from the musculocutaneous nerve, which is a key nerve supplying several muscles in the anterior compartment of the arm. In terms of function, the coracobrachioles plays an important role in shoulder movement. It helps with shoulder flexion, meaning bringing the arm forward, and adduction, which is moving the arm toward the body's midline. Understanding this muscle's origin, insertion, and action not only helps us appreciate its specific role, but also how it fits into the overall biomechanics of shoulder movement. Let's take a closer look at some of the key muscles we've been discussing. On this slide, we'll focus on the name of the muscle, its origin, insertion, and action. Understanding these details is essential because they help us grasp how each muscle contributes to movement and stability. For example, knowing the origin of a muscle tells us where it starts, typically on a fixed bone or structure. The insertion is where it attaches to the moving bone, and this attachment point determines the muscle's action. The action describes what the muscle does when it contracts, whether it moves a limb, stabilizes a joint, or supports posture. By connecting these points, we get a clearer picture of how muscles work together to enable our movements. This detailed understanding also helps in diagnosing injuries or planning effective treatments, which ties into the broader theme of anatomy's practical applications. The subscapularis muscle originates from the subscapular fossa of the scapula, which is this broad, flat surface on the anterior side of the scapula. From there, it inserts onto the lesser tubercle of the humerus, which is this small bump just below the head of the humerus. The primary action of the subscapularis is to facilitate internal rotation of the shoulder joint, meaning it helps turn the arm inward. This muscle is a key part of the rotator cuff group, playing an essential role in shoulder stability and movement. Understanding its origin, insertion, and action helps us appreciate how it contributes to overall upper limb function and coordination. Now let's take a closer look at the muscles we've been studying. On this slide, you'll see the name of the muscle, along with its origin, insertion, and primary action. Understanding these key points is essential because they help us grasp how each muscle contributes to movement and stability. The origin is where the muscle begins, usually on a fixed bone, while the insertion is where it attaches to movable bones. The action describes what the muscle does when it contracts. For example, if we look at a specific muscle, knowing its origin and insertion helps us understand the direction of its pull and its role during activity. And of course, the action explains whether it's responsible for flexion, extension, rotation, or other movements. Connecting this to the bigger picture, recognizing these details helps us see how muscles work together to produce coordinated movement. It's like understanding the parts of a machine. Each component has a specific role, and together they make the whole system function smoothly. Now, let's take a closer look at the supraspinatus muscle. This muscle originates from the supraspinous fossa of the scapula, which is the small depression on the upper part of the shoulder blade. Its main role is to help lift the arm away from the body, specifically in shoulder abduction. The supraspinatus inserts into the greater tubercle of the humerus, which is a prominent bump on the upper arm bone. This positioning allows it to effectively initiate and assist in lifting the arm. Overall, the supraspinatus is a key component of the rotator cuff, playing a vital role in shoulder stability and movement. Let's take a closer look at this slide, which focuses on the name of a muscle along with its origin, insertion, and action. Understanding these three aspects is key to mastering muscle anatomy. The origin is where the muscle begins, typically on a fixed bone or structure, providing the stable point of attachment. The insertion, on the other hand, is where the muscle attaches to the movable bone, allowing movement when the muscle contracts. Finally, the action describes what the muscle does when it contracts, whether it flexes, extends, abducts, or performs some other movement. By knowing these details, we can better understand how muscles work together to produce coordinated movement, which ties back to our overall theme of functional anatomy. Remember, the origin and insertion give us clues about the muscle's role, helping us predict its action in various movements. The infraspinatus muscle is an important part of the rotator cuff group. It originates from the infraspinous fossa of the scapula, which is the shallow depression located below the spine of the scapula. From there, it inserts onto the greater tubercle of the humerus, which is a prominent bump on the upper arm bone. This muscle plays a key role in shoulder movement, specifically in external rotation, which is turning the arm outward, and horizontal abduction, which involves moving the arm away from the midline horizontally. These actions are crucial for many daily activities and athletic movements that involve shoulder rotation and stability. Understanding the origin, insertion, and action of the infraspinatus helps us see how it contributes to shoulder function and stability. It's a prime example of how the muscles surrounding the shoulder work together to facilitate complex and powerful movements. Let's take a closer look at this slide, which focuses on the name of the muscle, its origin, insertion, and action. Understanding these key points is essential because they give us a complete picture of how each muscle functions within the body. When we talk about the origin, we're referring to where the muscle begins, usually on a stationary bone. The insertion is where the muscle attaches to the moving bone, and the action describes what happens when the muscle contracts, how it moves parts of the skeleton. Recognizing these details helps us appreciate the muscle's role in movement and stability. By connecting the origin, insertion, and action, we can better understand how muscles work together to produce coordinated movements. This knowledge is fundamental as we explore the musculoskeletal system, giving us insight into both normal function and potential dysfunctions. Now let's take a closer look at the teres minor muscle. Its origin is on the lateral border of the scapula, which is essentially the outer edge of the shoulder blade. From there, it inserts onto the greater tubercle of the humerus, the prominent bump on the upper arm bone. This positioning allows it to play a key role in shoulder movements. The nerve that innervates this muscle is the axillary nerve, which is important because it controls the muscle's function and provides sensation to part of the shoulder area. In terms of action, the teres minor is primarily responsible for shoulder external rotation. That is, rotating your arm outward, and horizontal abduction, which is moving your arm backward in a horizontal plane. Understanding this muscle's origin, insertion, innervation, and action helps us see how it contributes to shoulder stability and movement, tying into the overall theme of shoulder muscle anatomy and function. The teres major muscle originates from the inferior angle of the scapula, which is located at the bottom corner of the shoulder blade. From there, it inserts into the intertubercular sulcus, a groove on the humerus. This positioning allows it to play a key role in shoulder movements. Its primary actions include shoulder extension, which means moving the arm backward, adduction, bringing the arm closer to the body, and internal rotation, which is turning the arm inward. Understanding the teres major helps us see how it contributes to complex shoulder motions and overall upper limb function. It's a great example of how muscles work together to produce smooth, coordinated movements.